Hi everyone, how you doing? So, one question which I've been asked a fair few times after doing my whole video series on all-on-4 is how many implants is best for an all-on-4? So say you want to replace all your top teeth or your bottom teeth with something dental implant related, is it better to have 4 or 6 implants and support a full set of teeth on just a few implants? Or is it better to have 1 implant per tooth? So if you want to replace 12 top teeth, we're looking at 12 individual implants. Now, in order to answer this question, let's look at a case which I did. This is one which I did last week. It's kind of fresh in my mind. So I'm going to show you a photo now with all the lips out. Okay, and some people may find this a little bit uncomfortable, but it's the reality. I've desaturated it to make it a little bit less offensive. But what we're talking about is, can we use individual implants to replace each individual tooth? And in what situation would that be a better thing to do? So right now, I want to be specific. I'm only talking about those situations where all the teeth are pretty bad and it's better to remove everything and start again. So when we try and replace individual teeth, we often try and keep the gum level the same, or we try and preserve the gum outline in some way. And in situations where people are looking for this all-on-4 kind of treatment, the gums are quite often uneven. They have receded quite a lot because these people have been affected quite badly with gum disease. So keeping the gum from an aesthetic point of view doesn't make sense because the gum is literally all over the place. In addition to this, one of the first things that we do when we do an all-on-4 treatment is that we actually reduce the bone further. Okay, now this really sounds counterintuitive when you first hear it because patients who are looking for this kind of treatment have often been told for years and years by their own dentist that there's loads of bone loss and you can't have implants because the bone has all gone and things like that, which in a way is true. There has been bone loss when you have gum disease, but when we're looking at an all-on-4 kind of treatment, we actually place the implants much deeper in. So to do this, there's a number of advantages which I'll come on to in a minute to actually reduce the bone further. Now, before I go into all of this, let me show you a case where we have 2 front teeth missing. So you can see here that the patient's got a bunch of back teeth missing as well, and in particular I want to draw your attention to these front 2 teeth because this is a case I inherited. Somebody else had placed all of the implants by the time I started, and then I had to do the best I could in this situation. And the first thing I want you to notice is if we draw a line across this, that we've got the teeth on the patient's left, the pink triangles between the teeth, this is called the papillae of the teeth, are at one level, and then if we draw the line all the way over to the other side, the patient's right, where the canine tooth is, then that line is pretty much level. And if we draw this line, we can now see that we've lost maybe 2 to 3 millimeters of height at the gum level, but we can assume that that's the same at the bone level. So we've lost a decent amount of bone as well as gum. And this is going to create an aesthetic issue. Now, if I was starting this case fresh, I would probably look at some kind of complicated bone graft, something called what we call a vertical augmentation, where we increase the height of the bone before putting the implants in. But I didn't really have that option because all the implants were already done. So we then, in this case, we replaced all her back teeth with individual implants. She had 2 implants at the front here and a couple of porcelain veneers as well. Now, this is the end result, and it is a lot better than where we started, but it's not perfect. So especially where we've got these 2 front teeth, you can see the amount of bone loss and how that translates into the end result. There's been a lot of, it looks like there's a recession on this tooth because the gum line is so much higher up on it. Also, if we look in between the implants, this is something that's so difficult. I was going to say almost impossible. It's not impossible, but it's very difficult to build up papillae. So papillae are these pink triangles in between the teeth. So you can see on the patient's left, we've got nice defined papillae which are going quite a way up into the tooth, whereas on the patient's right, especially where we've got these two implants, we've hardly got any papillae at all. Okay, so this is the problem that we face when we've got two teeth which are out next to each other. If we have a full set of teeth and all the teeth are out, it's a million times more difficult than this. Okay, and I've never seen a really good case where we've had where the patients had individual teeth implants. Okay, so coming back to reduction of the bone, let me explain why we do this and why we do this in the vast majority of cases. The first is the infected tissue. So here we've got a case, when she smiles you can see loads of gum, so that's the second issue I'll come on to in a minute. But she's already lost maybe 2 or 3 millimeters of gum that we can see. You can see the necks of the teeth and you can see black triangles in between the teeth. That shows that we've lost a lot of gum. But the place where all the infection is usually 2 to 3 millimeters beyond what you can see. So this red line kind of signifies where the infection might be, and all this tissue around there may still be infected. So it's not great that we've got all this infected tissue and we want to put implants in, and implants can get gum disease, because obviously we want the implants to be there for as long as possible and no issues in the long term. So one reason for reducing the bone is that we can physically remove a lot of this infected tissue. When you take all of the teeth out, the gum has infection around it, but also the bone has all these bacteria as well. So if we reduce the bone, take 2-3 millimeters off the bone, we're actually removing all of this infected tissue. Our implants are going into much fresher, healthier bone. So that's one advantage. But also, if you look at this case, if this patient was to smile and we didn't take out the infected tissue, then you'd always see that transition between the fake teeth and natural gum, and it would look like a disaster. It would look so bad. So in order to hide this transition, quite often we do extra reduction in complicated cases, especially like this one, where we then take off more bone just so we can hide that transition. So no matter how wide the patient smiles, you can't see that transition between the natural gum and anything fake that the dentist or the technician makes. So this is all well and good. I've talked to you about reducing bone, but I haven't really addressed the question right at the beginning, you know, what's better, one implant per tooth or a few implants and a full set of teeth? Let's look at this bone reduction thing in a little bit more detail, because by now you should get an idea why we do this bone reduction and why it's an important part of the treatment. Now, if we imagine the top jaw bone, and we just imagine it's a cylinder, for example, something like this, and we put one implant per tooth, okay? So let's say we've got all our implants lined up like this. If we then decided actually we wanted to bone reduction and put the implants higher up, it's not really too much of a problem. We just take a little bit of bone off at the bottom, however much we need for all the reasons that I've just mentioned, but then we can just place our implants higher up, and we've still got a situation where we're able to place one implant per tooth but just higher up. Unfortunately, this isn't true because the upper jawbone isn't this shape. It's actually a little bit more or like a base of a cone. So in that kind of situation, we have our kind of top jawbone is kind of shaped like this. If we've got one implant per tooth like this, and that's, you know, that's without any bone reduction. As soon as we do bone reduction, then we've got a situation where if we tried to place our implants higher up, we physically don't have the space to do this. So it suddenly becomes a lot more difficult to do this one implant per tooth once you've done this bone reduction. Because of this lack of space, that's one reason, but also implants need a bit more space than natural teeth in between them to get all the blood flow and make sure that they are healthy long term as well. So we've got physical restraints on how many implants are possible in individuals. In addition to this, what I haven't even talked about at all is that towards the back of the mouth we have air sinuses. At the bottom jaw we've got nerves that we need to avoid and deal with as well. Again, making things a lot more complicated, and as soon as you start losing bone, the air sinuses get closer, so you lose bone for placing implants there, unless you do sinus grafts and adding extra complex surgeries into the equation. And the same's at the bottom. You've got the nerve at one level. As soon as you start taking teeth out, the bone can reduce, and it can reduce the amount of bone you have to place your implants there. In addition, the lower jawbone flexes as well, and you have to take that into account when you're planning treatment too. So I don't want to get overly complicated in this video. I just want to show you the reasons why I personally believe it's better to have a few implants and a full set of teeth on the implants, rather than going through all the complicated surgeries to rebuild bone, because that's the first thing we need to do, is rebuild the bone so we can have all the space to put our implants, and then do all these soft tissue procedures to get these papillae in between the teeth so that the end result looks natural. So here's a picture of a typical final bridge which I did for one of my patients a couple of years ago, and you can see that if, okay, on the stone model it looks a bit weird, right? It always freaks people out when they see it on a stone model, but the actual teeth look natural, and we've recreated all of the papilla, which we would never be able to do no matter how good the surgeon is. You'd still need 10, 15 surgeries before you can even get to a point close to this. It doesn't look like the gums are infected at all, and this is good for the long term as well. So in this case we had 4 implants supporting this full bridge. The artistry was in creating the gums to make them look natural, but also making the teeth look natural. And this is denture teeth, this is not ceramic teeth either. So in my personal opinion, we've got physical limitations on how many implants we can place. And if we can get such a great result by just using 4 to 6 dental implants and putting a full bridge on that, and you can do it in minimal surgeries, surely that's a much more sensible kind of route to go. And also the costs involved. If you look at an all-on-4 kind of treatment, it's really nothing compared to the implant costs for a full set of teeth 15, 20 years ago, which would have involved sinus lifts, it would have involved complex bone grafting, and then multiple implant placement appointments, and all the stages involved in being able to do, in being able to have a full set of teeth on dental implants. And the aesthetics weren't even that great. Okay, so I know I've gone off topic a little bit on this video, but I hope you understand why it's usually better to have a smaller number of implants for a full arch. Okay, if you've got any questions, comments, you can pop them below. I do try and get back to everyone. So take care.